Man, the wrist and hand is complex. We've got the proximal and distal carpal rows. We've got to get them moving again on the radius on each other when we try and restore motion in the wrist and hand. So what I need to do is assess which direction the carpus needs to move on the radius when we're trying to restore movement. If somebody comes in with a palmar flexion limitation, I need to be able to get the carpus to move dorsally on the distal radius and ulna. In order to do that, I could move the carpus. That's awkward. Let's move the radius. So to regain palmar flexion, we're going to get them in a pre-position of palmar flexion, slight ulnar deviation, and now what I'm going to do is I'm going to move radius on carpus on the proximal row. I've stabilized the scaphoid tubercle and the pisiform here, and now I'm going to use my hand with my forearm perpendicular to the long shaft of the radius. I'm now going to move in a palmar, slightly proximal direction. I can first oscillate at the end of the range, and then I can add slight pronation spin because the carpus needs to supinate on the radius. So I just work backwards, and I can add that to it. And then at the end of several oscillations, I can hold, or I can ask the client to try and flex her wrist into the mat. So try and pull it down just to reactivate the locomotor system. And this is a really nice technique to get big gains in palmar flexion really early when they come in with a stiff wrist.